Hi, welcome everyone. It's Captain Connie Grant. I'm a nursing officer at the GK Medical Clinic, and we're going to talk about COVID-19. I'm going to be joined in this session with Sue Piche, another nurse, who's going to assist with answering some questions at the end of the presentation. A lot to talk about with this, so yeah, I hope that this will generate some conversation, some questions, and I look forward to hearing everything that you have to say, the questions that you have out there, to provide a little bit more feedback out to you with the information that you're looking to have. So what I've prepared for you today, this overview on where we started and where we are now, some prevention strategies, how to reduce your risk, general advice, flu, as that's the hot topic of the next couple months, and we'll take questions and get some feedback as well. So where we started, wow, early in 2020, but the virus really peaked or started in 2019, but we didn't see it until 2020 in some of the countries that we're in now, when it really affected how we were living and what we were able to do or not do. And it is a novel virus, so it hasn't been seen before. And we were all sort of affected at different times, depending on which country we're in. And Europe was really affected before Canada. So this really affected the guidance that we were getting from Canada, where we were ahead of them, and what their lessons learned were coming a little after our lessons learned, that's for sure. And there is a lot to learn. There's a lot to know about it. A lot to figure out where this is a novel virus. How does it react? What are the symptoms? And that continues to change. Who does it affect? How does it affect them? That's still a lot of research to be done in those areas. That's ongoing. And a lot of changes, so many changes, more so at the beginning when we were really trying to figure out what's going on, what do we do, what's the best response, how is that impacting everybody? And what can we do to continue life as normal as we can. And the changes continue, though. I hope that they're slower a little bit now than they were at the beginning. I don't know the experience of everybody. I think as we have different experiences and try to adapt, we become a little bit more comfortable with the expectation of what's to happen. I hope that's true. But really, we've come from, at the beginning, certainly wearing a mask was not normal, not usual, and now it is. And a lot of testing, a lot of talk about testing, access to testing, a lot of changes to do with that as well. And it's hard to keep up on everything and what's right, what's not right, what's the best, what should we be doing. A lot of info. And certainly every country's response is varied. When I speak to people across Europe, the ways things are being done is very different, which is interesting as well. And neither are wrong, but we have different levels of approach, I guess, and we have to look at the country and the context in which these rules apply, and why it might be different in some and not in the other. And the changes will continue. It's definitely been isolating, and isolating in many ways. Isolating because you're required to isolate, and isolating in terms of family, access, travel, connection with others, socializing, even workplace, being together with people in the ways that we've known is a little bit different. So where we are now, goodness, we've come a long way. If we think back to February, March timeframe when things really started to shift and close down and change. Again, research continues, change will continue for sure. Masks, so the Public Health Agency of Canada recommends that we wear a mask when we're anywhere within 2 meters and we can't maintain space distance. In some countries it's required by law, some it isn't. Sometimes you need to wear them to access services, or if you need to wear it in your workplace. So a lot of different rules around masks. And I mean, you have to follow what is required to get what you need done, or to access services, or to be out in your your host nation if that's required. Testing is one of the most important tools that we have to track the spread of COVID-19 and work to stop it through contact tracing and more isolation. And that's really a test of patience. You know, if you get to the point where you're being tested and there's a bit of a wait, and there's some patients, and sometimes your symptoms might have resolved before you get your test back, and you feel like, no, I'm fine. But it really is actually crucial that we abide by these rules, these policies, and listen to the advice that's being given by the public health, by us as a medical team, to make sure that we avoid spreading within our community and impact to ourselves and those around us. But certainly it is trying, and especially when you're home with your family as well, to wait out sometimes numerous days. So there are a lot of different types of tests out there, and they have different turnaround times. Some of them are right away, some same day, but some can take 2 to 5 days, and sometimes a little bit longer. Sometimes it takes a little bit longer to get access to a test as well. You don't always get it right away, same day that you want to have it. Then you have to wait on top of that for access to the test, and then wait for the results. And that is definitely probably a biggest nuisance for most people who've gone through that before, or who've gone through it more than once. Yeah, so the turnaround time for the test depends on what type of test you have. Depends on the demand in your communities with your public health and with the processing of the lab products themselves. Yeah, so just one more note about testing. Antibody testing, so that's the blood type testing. There's been some questions about that. And it's really not a test that we support right now. It's not a test that we do in the GK clinic. Because there's not enough research out yet about that. And what that type of test will tell you is, have you been exposed to COVID-19 before? And so that doesn't indicate anything about an active illness, and it doesn't tell you how long you might have immunity for, what level of protection that immunity is. So there's not a lot of great information about that we can get. Sometimes it's just used now to rule out COVID-19 if there are other clinical presentations that we're looking to just take that off the list of possibilities, but not to be used as a test all by itself. That's not our number one go-to. I know that in some places that is the test that they are performing. And certainly, we can't change what options are available, but we can change the guidance around that a little bit if we need to look at that a little more in depth. Okay, so distancing. So that really started early on, and it makes sense. It's easily to most people, in that if a virus spreads from person to person, we should stay distant from other people. So that's great, but we do lose our vigilance on that one a little bit as we get comfortable, as we have some lower numbers in our communities and we feel a little safer, feel a little less on edge or heightened alert about COVID-19. So it's important to just remind ourselves that is one of the easiest number one things we can do to help protect ourselves and those around us. And traveling. So traveling, oh, I miss it. There's a balance to be struck here with wellness and safety. So caution when you're traveling. Make sure that you do check out where you're going before you go. And that changes as well. The restrictions change very, very quickly. They can change just overnight while you are somewhere. So please, as we head into the school break, Christmas breaks, that you're aware of what's happening around you and what policies might be in place in a different country that you're visiting or a different region that you're visiting. And our vigilance, we're socially cautious, or I hope that we are. We should be keeping ourselves, social when we can, but in different ways and a little bit more mindful ways about how we interact with others. Smaller groups certainly are better, and keeping contacts, a regular, what do we call it, like a cohort of people or a bubble of people versus, you know, broad connection with everybody as a whole, where you're really your potential is a lot higher. So yeah, here we are, and it's very, very different. I think we're all looking for some normalcy, and we're in the little ways that we can, and finding those ways to go about life. As we start to see more cases now, I think we are having to become more vigilant again and rethink how we're approaching things, and how are we doing with masks and distancing, and just kind of work through this the best we can and carry on. So prevention strategies, man, hand washing, yeah, I think we got it. We know hand wash. And what we really want to be mindful of for hand washing is that we can pick it up, certainly, from surfaces where, you know, respiratory droplets particles may have landed, and then we touch our face. We touch our face so often, and that's certainly how we're going to spread that to ourselves. So hand washing, absolutely, continue doing so. I think we can probably move on a little bit from hand washing. Gloves. So gloves are required in some locations. Not really necessarily something that we say as Canadian healthcare providers that you should do. If it's required, certainly carry on. You're required to do that if you're out or if you're at work, or whatever the case may be. If that's required in your host nation, by all means do so. Just a caution, though, that it can provide a false sense of protection, and it does not replace hand washing. All of that still needs to happen. And when you wear gloves and you're out in public, or you're out, like in this photo, grocery shopping, or out in the community, just be mindful of how you take your gloves off, and that you don't contact your glove surfaces with your bare hand when you're removing them. Just, you know, sort of take them off by the cuff, and then do wash your hands after you've taken your gloves off, absolutely. Okay, so masks. So we were all now quite familiar with the homemade cloth masks, whether you're making them yourself or buying them in a store, or having them supplied to you through the military. What is recommended are 2 layers, and needs to fit over your nose and your mouth, and we like to see no gaps around your face, and it should fit your face well. There are other masks, though. So the ventilated masks, they're those ones with the little valves on them, and that really is absolutely not recommended. And I think you'll see in some places they will not allow you to wear them. I know in the school here you cannot wear a ventilated mask. The particles just really travel through that vent, and so then it really just kind of negates any benefit that it would have for protecting you, protecting those around you. With that just kind of free air movement. And you'll also see those plastic guards, face shields, some of them almost like, they're just like little plastic mouth coverings that kind of come across the front, and those as well, those would not be something that we're saying is the ideal choice. They will redirect the droplets. You know, if you coughed or sneezed, they will redirect that from projecting out to sort of down, but it's still a very much free-flowing particles. Not the number one choice, not something that we're saying you should do. The best case solution is the homemade cloth mask of 2 layers. That's what we're looking for. Okay, so distancing is very, very important, but distancing coupled with time as well. So distancing, we want to be 2 meters apart. And why that is, why 2 meters? If you cough or sneeze, we know that the particles can travel up to that distance. So that's why, you know, if you had COVID-19 infection and you coughed or sneezed, the particles, this is how it's transmitted through your coughing, sneezing, respiratory droplets, can travel that far and land onto another person or surfaces. So staying that distance from others of 2 meters, that's where that comes from. That's why that's important. That's why as well, coupling that with masks is even better. And then the time of 15 minutes. So I'll tell you, when we're looking at contact tracing and who's at risk, if there was somebody that you were exposed to that was positive for COVID-19, we care very much about the distance that you were with that person and for how long you were within that 2-meter distance. So these are the things that are going to set you apart from being, a medium low risk or no risk to a high risk, whether you're wearing a mask or not. So I do want you to pay attention to the distance that you are from others and the time that you're spending. And when we're asking you about who your contacts were, or asking you when you've been identified as a contact, if that's the case, then we want to know these things. So this is something that I want you to focus on when you're out and interacting, or when you're in your workplace. Think about that as, a bit of a caution for how to proceed in navigating these circumstances with others. Okay, I love this. I love this one so much. So here's the imaging of the spray. So how far and how much these droplets can travel. And you can see that a cloth mask, certainly no mask it's everywhere. A cloth mask with just one layer, and so you'll see that there's a recommendation that net gaiters or scarves are not the ideal choice, and this is why. So a cloth mask with one layer can certainly still spread quite a bit of particles out into the air, and then compare that with the cloth mask with 2 layers, which provides more protection. And there's some more research showing the effectiveness of 2 layers, and not so much conclusive evidence of any protection with just 1 layer alone. So that's where the 2 layers comes from, and that's where the distance comes from. You can see in the no mask situation that can get everywhere quite quickly. Okay, so reducing your risk. So definitely we all have to follow the advisories that are out in our communities, in the countries we live in the towns we live in. And these might change over time as the cases in your local areas kind of grow and reduce. You want to avoid, unnecessary exposure for sure out in the community, but within reason. Health and wellness is still very important, and you want to make sure that you do have connections with others, that you are engaged as much as you can be in a safe way. If you are going to be social, again, limit your bubbles to certain people as much as is reasonable. Time and distance, we talked about that. That's very, very important. And stay home if you have any symptoms. And we don't want people going out anywhere when they have symptoms of anything, whether it's you say, oh, I just have the sniffles, or, oh, every fall I kind of get this little cough. Those things are very important. It's very important that you stay home and that you don't spread even just a simple cold to anyone else, because those symptoms can be considered as COVID-19. It increases the testing that's maybe not required for those who might have caught that around you. And it puts everyone at another disadvantage when you compromise the respiratory system and then couple that onto potential exposure for influenza or COVID-19. Okay, so another key thing, and this isn't always known or understood, is that if you are being tested or considering that you might require a test, your household members should all stay home. So if there's a test that's pending, if you've been tested, they all should stay home until the result of that test is received. That is the guidance that we will provide you from the GK Medical Clinic. That is the guidance that they should be providing you from your host nation, though that may not always be explicitly explained to you, but that is the best case scenario, that everyone stays home until the result comes back that can clear the rest of your non-symptomatic household members to go back out into the community. We want to be good citizens and not be spreading potential respiratory illness, or certainly COVID-19, out into the community ourselves and with each other as fellow Canadians. And you need to seek guidance whenever you're unsure. That's what we're here for. call us. Call me. You'll probably talk to me, and I'll give you some guidance on how to navigate the situation in your host nation, or if you're having trouble with anything and you need some help. Call us. That's what we're here for. Okay, so yeah, general advice, follow your local protocols and guidance in your community. Any questions at all? And I was going to give you some examples of why you might call us, but just call us. If you're not sure, if you're sitting on the fence about something, you don't know how to get a test, it's taking a while to get a test, or you're being given advice and you're not sure that that's the right advice, you're being told you don't need a test, you think you need one, give us a call and we'll work through that with you and try to apply some of our guidance on top of the host nation that has a best fit for the outcome we're looking for, which is really just the protection of you as an individual and the protection of our community as Canadians and the protection of those citizens in the countries that we live in, for sure. Okay, so if you're being tested, or if you've had a test, or if you're being tested, we would like to know. We want to know what's going on. Lets us know what kind of tests are going on out there. Lets us know that there's a potential outbreak in a certain area. We definitely need to know if there's any positive cases out in our communities and in our workplaces. And we will track it, and we will call you, and we will support you, and we will answer your questions from a Canadian context, and we will provide you some guidance. We can also work with your employers if there's any need for further communication about what our recommendations are. Of course, stay home if you're sick. This year especially, we do recommend that everyone gets a flu shot. Again, that's one, protects yourself and protects the others around you, and it protects us from, kind of overdoing COVID-19 vigilance and testing if it's really, a flu that could have been prevented. That's very, very important. Okay, so contact tracing, this is where things get very interesting for us. How does it work? So like I said earlier with the distancing and the time, there are levels that we look at for contacts, and we really need to determine whether you are high risk, medium risk, or low risk, and that will be like the deciding factor on what guidance we provide you, whether we say you need to stay home for 14 days, or whether you can just monitor yourself for symptoms, or what your household members need to do, or do we recommend you get a test, all that sort of stuff. So we ask a lot of questions, but we do want to know very much so how close were you and how long were you close for. Those are the big questions. And so a little bit about that. So if you have symptoms and you've tested and you're positive for COVID-19, the course of the illness is about 10 days. And this isn't a hard and fast rule, but this is guidance. This is the general guidelines, 10 days, and then you're free to carry on as long as you are symptom-free for a period of time, 24 or 48 hours before, no fever for sure, and taking no medication. But if you're a contact for somebody who has, been identified as positive for COVID-19, then you're looking at 14 days to see if, because you could present with illness at any point up to 14 days. So the guidance of 10 to 14 days really depends on your situation, on your risk, exposure, on your contact, on your own illness, and then whether we recommend that you get testing and whether you're positive. So it is very person-specific, case-specific, with some general, overarching guidelines that we go by to make these decisions and to provide guidance. So, yeah, so you can't really say, well, someone else I knew had this and was told that. It doesn't really translate to every case the same. So just be mindful of that. But that's if you've heard 10 days, 14 days, there's a difference there in why we might say one or the other for sure. Okay, so influenza, the time is now. If you haven't got your flu shot and you can get it in your community, we do recommend that you do so. Our flu shot supply is coming to GK in the next week or so, so our clinics locally will be starting up very, very soon. And why we want that, so influenza is certainly a respiratory illness, causes quite a number of hospitalizations every year. and it's preventable, or at least can prevent a large number of cases out there. And we don't want to see influenza cases within our community that could have been prevented end up in hospitalization. Hospitals are very busy, full, max capacity demand for both their staff, their supplies, their bed space with COVID-19 and being prepared and waiting to be able to manage COVID-19. So influenza, we want to keep it out of there. We want to keep our community free from influenza and do everything that we can to use the prevention that we have, which is the flu vaccine. So anyone who's 6 months and older, definitely we recommend it. If you're having trouble getting the flu shot in your community, we definitely want to hear about that. And we can work with you to try to achieve that for you. But we want to keep our respiratory systems healthy because there is, of course, the potential for the double whammy, influenza and COVID-19. And that hit to the respiratory system will not be positive. So I do encourage everybody this year to get your flu shot. Okay, so here's our email address, and it's a general inbox that is monitored by our reception, our med techs, our health team, and myself. So anything that comes in here, if there are any questions, we will respond to you. We will call you. Whatever it is that you need to support you, we will do so. If you want to call us or email us and let us know that you're symptomatic and you have been tested, that's the way to do it. If you want to call and speak to me directly, I welcome that. Please do. Please do call me. Okay, so I'm going to hand this over to now Sue Pichet, who's going to lead the discussion questions. So I will leave you, and I want everybody to know that we do want to hear from you, dependents as well as members at the clinic, about what your troubles are, what your concerns are, what guidance you want from us. If there's something you feel that we're not providing to you, I want to know, and I want to be doing that, but I need the feedback. We do need to hear what's going on out there, what struggles are you having, because it's you who knows your location, your country, your situation best, and how you're feeling in the situation that you are in, that I can't assume, and I don't want to assume. I want to know from you exactly how things are going and what you need from us. So at this point, I will leave this to Nurse Sue Pichet to lead the discussion questions, and I thank you for your time listening to this presentation.